Good morning, Turks and Caicos. Welcome to First Edition. I've got two interesting guests this morning, two individuals I know well. Please help me say good morning and welcome the Minister of Health and Human Services, the Honorable Kyle Knowles. Honorable Knowles, good morning.
Good morning.
To see you again.
Yes, thank you. Thank you for having me.
And of course, with him this morning is someone who really doesn't like television much. She is the Permanent Secretary in the Ministry of Health and Human Services, Mrs. Desiree Lewis. P.S. Lewis, good morning. Welcome.
Good morning. Thank you for
We
having
promised
me.
to just have a great conversation this morning.
Looking forward to it. Thank you.
Okay, so let's get started. We know that there's a lot of public interest in the National Insurance Health Board and all the circumstances and issues in the public right now concerning it. So, Minister, it's just been about 4 weeks or thereabout that the Board of Governors and the CEO were removed. What has actually changed in that time?
Well, thank you so much for the question. And again, always thank you for allowing us to come and use this platform as an opportunity to communicate what's currently transpiring. I do note that there are a lot of questions in the public domain around what has transpired. Of course, you would know that there have been two levels of communication that would have been disseminated. And I think there lies where the questions would derive from. But to answer your question, we're currently in the state of having an examination done to the entity. And the gist of it is really to get down to the root cause of some of the inconsistencies that would have been brought to our attention over the years. I would say while it is not a new problem, I think what we would have done as the government of the day is taken a very proactive approach to address a lot of the concerns that were brought to our attention from the public.
So, and just before I ask the PS, the question that I have for her, there's a lot of public concern about why the statement came from the governor about the removal. Explain that for us.
I'm glad you raised that question early, because that's definitely a conversation that both the PS and I had. And we have to remember we're a country of laws, and being a country of laws, there are certain practices or certain wording or verbiage, I should say, in the legislation that speaks to the governor. And I can't quote the section at this moment, but it speaks to the governor being the individual. But what in interpretation, it's the governor and cabinet. So the governor and cabinet means that there's a consensus with all of us as a body, as the executive, that make the decision, but the wording would always come out or will be presented to the public as the governor. So it's not a situation where, as elected members, we're hands off. It's just the verbiage, and you'll find this throughout legislation. So many times the general public may feel as if the governor's position is solely based on her discretion, or the decision is based on the governor's discretion. While there might be some aspects to it from a variation of legislation, in this in particular case, it's the governor in collaboration with cabinet. So it's the governor and cabinet.
Okay.
And I hope that answers your question.
Thank you very much for that. P.S. Lewis, the minister just mentioned examiners. So who are the examiners and how were they chosen?
So thank you again, Cheryl, for having us with you this morning. So the examiners are from a company called Interpath. Interpath has about 23 locations globally. They have persons based in BVI, Bermuda, so they have that regional experience. They come with that. They have a location in London. We had a selection from about 2 companies, right? Interpath and another company. Both their submissions were basically the same. Were basically almost the same in terms of how they would approach the process, and a difference in variation in fees. So both companies were reviewed, and Interpath, we felt that they would bring a better solution to the table for what we are currently undertaking right now. So the Ministry of Health went with Interpath. So we reviewed their submissions, and we're comfortable that we have made the best choice for the job that we need to undertake at this time.
So what's the TOR for the examiners? What are they expected to do?
So basically, the examiners will first, they have about 3 phases. They have the field work first that they're approaching now, where they're carrying out their reviews to provide the government with an in-depth report after the first month or so that we would know exactly where we're heading. They have been recruited to also implement a stabilization plan. Amongst Interpath, you would find that their staff are well versed in forensic accounting. They will review their organization's accounts, and as the minister would have indicated, the issues that we're currently facing, they are not new issues. And some of them are deep-rooted from inception. So the whole idea is to review the organization, carry out a forensic review, provide a stabilization plan, and hopefully within the next week or 2, the minister will be providing the general public with some additional information on the direction on where we will be going in terms of their first report. So whilst we haven't received their first written report, the minister, the governor, the premier, we have been receiving updates. We have been receiving updates, and they have been keeping us abreast of the work that they are carrying out. So in a nutshell, Interpath is a forensic accounting firm. They provide advice to companies, not just accounting firms. They provide advice to governments as well. And they give directions and provide stabilization plans and assist you with where you want to go with your business. And that is what we need. Sorry, you asked one question, but in terms of their work, we can see that from the conversations that we will be pleased with the outcome, right? And they're providing us with advice each step of the way. And that is what we need. From a ministry perspective, and I'm quite certain from a ministerial perspective, we need to know what is happening at every moment, because at any given time, someone from the general public will send the minister a message or send myself a message, and they even go to the governor. They go to the premier as well and the deputy governor. And so we have to be prepared that in any circumstance, if a question arises, we're in a position to respond.
That makes sense.
And we're finding that in Interpath with the work that they've been providing thus far.
Well, let me ask this, and I'm glad I'm sitting across from the PS. Listeners and viewers, you'll understand why later on. But let me ask this. A host of RTC, one of RTC shows, asked the Premier a few weeks ago when he was on why a local company wasn't chosen. Now, personally, I think knowing our society, it was probably better to avoid the personal attacks, you know, the personal conflicts, that sort of thing. But the individual wanted to know why a local company wasn't chosen when local companies have the expertise, or they partner with regional and international companies with that expertise.
You want to go?
Yeah, I mean, from the understanding that I have is that local companies were approached. Some local companies are also engaged in other major projects. I think the urgency of what we needed at the time, and the level of, or the depth of what we needed to accomplish at the time wasn't readily available. So when we think about onboarding services, of course we want to give, you know, local companies the opportunity to provide those services, but, you know, the clock was ticking. We needed to act now, and the urgency of it really dictated what those outcomes were. So it was I believe that it was never our intention to just go, you know, internationally and then bring in a company. We would always want to utilize the services that we have available. And if we want to be fair, some of those companies have done work in the past, right? So if there is a need for correction, you know, sometimes you can't go and correct your own work.
Yeah.
You need to have a second pair of eyes.
Yes.
So this is business. There's a high level of accountability, transparency that is needed. And if we want to make sure that the public is clear as to what we are trying to achieve, then we need to take or make the decisions necessary to do that. That's the reason why they would have elected persons like myself and the others. And, you know, the PS from her technical background would provide the necessary support and helping to guide the process. So I believe that is the gist of it.
Honorable Minister, you know, sometimes the public comments are really harsh. There have been comments to the effect that the removal of the board of directors and CEO has disrupted the continuity of the NHIB. True or false?
Again, as I stated earlier, we are a country of laws. One would even argue that enforcement is somewhere where the breakdown may come. Legislation speaks to the ability to remove a board without prejudice or to act in such manner. And I think what I'm really trying to get at is that we were in a place that needed urgent attention.
Right.
And it is important that we understand that the level of, or the response needed at that time required a proactive approach. We did what was necessary within the perimeters of the law. We are aiming to achieve that with the examiners. There's never an attempt to offend or to you know, take advantage of certain scenarios. But when you are placed in a position in positions like the PSNI, there are certain outcomes, right? We're dealing with financial matters, we're dealing with sensitive health matters, we're dealing with sensitive medical matters, and that's not the time to play politics, okay? Because when the phone rings for either one of us, that could be a life or death situation. So the time you're going to take arguing about why this one was removed or why this person's tenure wasn't allowed to go the full extent, you know, the conversation I'm having on the other end of the phone is, this person is really ill. How are we going to expedite services? So
services haven't been disrupted.
Services haven't been disrupted, and I'm glad you brought that up at this time. That was the premise of why we needed to bring in the examiners, because we didn't want to find ourselves in such a position that services were disrupted, and I think if the general public is fair, and I go on record by saying this, while services aren't where we want them to be, services haven't been disrupted, because I've been receiving a number of calls. The PS has been receiving a number of calls. My colleagues have been receiving a number of calls. And I think to date, we have been responding in a very favorable manner to make sure that these persons, their issues and concerns have been addressed. Not saying they weren't being done before, but it is our mandate to make sure that these services weren't interrupted. Because when you think about healthcare, providing services, the standard of services, these are the things that have to be worked on. So you can only imagine if services were halted, where we would really be. You know, and that's a very scary place to be. Or, you know, so we have to remember that while there are certain perspectives as to what people may want or what they think should happen, you know, we're the ones dealing with it on a day-to-day. We are open to constructive criticism. We are open to what the general public is saying, but we also have to be guided by the parameters of legislation.
If you're just joining us, this is First Edition, and we have the pleasure of having the Minister of Health and Human Services, the Honorable Kyle Knowles, and the Permanent Secretary with responsibility for that ministry, Mrs. Desiree Lewis. Now, P.S. Lewis, we know that our human resources are important.
Yes.
What is staff morale like?
Good question, Cheryl. So you have, in every organization, there's always a need to ensure that we continue to do our best to boost staff morale. And the NHIB, no doubt, given what they are going through right now, you will find that some persons, their morale may not be where it should be. And this is why the process is so important, and that it is open and transparent, and that we try to continue to advise staff that what is currently taking place is to ensure stability in the organization and the longevity of the organization. The NHIB was created as a mechanism to ensure that we carry out universal health care, and that's what it's all about. It's all about giving persons that type of access. And so even through this process, we have a mandate to ensure that we let staff know that this is not about job stability in terms of you losing your job or misplacement. It's about ensuring that the atmosphere that you work in, that it is conducive to productivity, and that we carry out the mandate in which the NHIB was established to carry out, to ensure access to good health care. And that's what we're trying to do. We're trying to encourage them to make sure that they know that we have your best interests at heart, and we will do our utmost to ensure that the environment that you work in, it is pleasant and conducive to productivity.
That is so well said.
Yeah.
That was great. I hope the staff of the NHIB heard what the Permanent Secretary said. Now, my next question, not sure which one of you will answer, but from your perspective, from where you're sitting, that level where you are looking at the whole operation, would you say that the NHIB, the model, is still fit for purpose, or should we have a complete redesign? Or is that something we're going to leave to the examiners to determine?
I think it's fair to say that we should leave it to the examiners on the basis that the country has grown since inception.
Yes.
We are still experiencing significant growth population-wise, so there'll be a greater demand on the level of medical services to be provided. Yes. It can call for an expansion of the NHIB just from a service delivery standpoint. So the universal healthcare model is still relevant. But to answer your question, at this juncture would be somewhat premature, just because the examination is currently going on, and then of course you have to factor in medical costs, operational costs, staff capacity, level of services provided. All of those things, coupled together will dictate what that model might be. So it's necessary, but it'll be kind of premature to answer that at this time.
And since we're talking about cost, let's talk about the customers. Should we continue to make our contributions? Should employers still be making contributions? People are hearing that things are kind of in disarray, and I ain't gonna pay. Is that the procedure?
No.
Is that the advice?
Minister, may I?
Please.
I don't think that should be our perspective on it. The NHIB is still operational, and we are encouraging persons to continue to make their contributions as always. Yes, we're going through a change, which is necessary,
Right.
but this does not mean that subscribers should not be making their weekly or monthly contributions, however they make it.
And is it still being accepted cash or card only? Is it any form of contribution still today?
Well, just to echo the same sentiments as the PS, it's very important that persons continue to contribute. Medical costs around the world are high, and TCI is not exempt.
And we just saw the tariffs being
And we
introduced.
just saw,
Gonna
and we
send
just
it
saw the
higher.
tariffs.
Yes.
Exactly. So
Yes.
when you think about the global impact, and you know, persons are sick. You know, healthcare in this country is not to be taken lightly, and to put that full burden on any government it'll be a significant strain. So there has to be a level of you know, there has to be a heightened level of responsibility to make your contributions. And then, too, I'll pivot a bit into the compliance aspect of things. There's going to be a greater emphasis on compliance because we do have, or it's noted that there are some persons who feel compelled not to pay, right, but still want medical services to be rendered. Yes, we do understand that there might be some breakdown in, you know, certain levels of communication. And I mean, I can speak to this because I'm sure it's public knowledge.
Yes.
Someone might go to the hospital and they might say, well, you know, you're not registered or your account is not up to date. Those are internal breakdowns that we're currently working at to make sure that persons aren't denied medical care. But the truth behind it is that in order for that to be a fluid process, you need to make sure that your payments are up to date. Because if we're going to make sure that the systems speak to each other, it can't be a situation where you're not paying, but you're asking for medical care, then you get to the hospital and you're given a bill, then you put us in a compromising position. Yes, some persons may say one might not have anything to do with the other, but that's the model, right? You have to pay. So paying helps the government to assure or that medical services, regardless of what you may think they are available, as we work towards standardization and providing, you know, a wide selection of services from a local standpoint. So compliance, I'm sure once we are given a more comprehensive report and we're able to come back to the general public and say, well, this is the current position as we move forward, compliance will definitely stand out as one of those priority areas that are important. And I would say to persons now, you know, start, you know, go in, you know, find out where you may be lagging so that you don't find yourselves having to back pay for so many weeks or months, if I can even say that. We need not use this as a crutch not to pay. Because the only persons you're going to hurt are the clients at the end of the day. Those hotel workers, you know, the waitresses, all of these persons who go to the hospital in the wee hours of the morning seeking services, only to find out that their employer, who's deducting this money from their salary, hasn't been remitting it into the entity. And that sparks a different conversation that we won't get into now.
But it's really good. I mean, I remember some of us years ago who had our children away. We know the cost of what maternity care is like, and we can go here, pay our register $10 and have our babies delivered safely and comfortably. So it is something that's worthwhile. And it serves a purpose.
It does, and we have many of our regional partners who envy TC Islanders because of how we're taken care of, and they don't have the access to the health services that we do. Imagine if you're sent overseas for treatment abroad, the government pays 100% of your care. 100%. Not 80%, and there's a deductible for you to pay. 100%. So this is the type of messaging that we need to continue to say to the general public. Continue to pay into the scheme. Yes, we're trying to make it better, but continue to pay. Encourage others to pay as well. And even if, like the minister alluded to, there are some changes that we're going through in the organization. And even if you make your payments in the bank, make sure that you remit the payment slips in the organization so that there will be some traction as to what you've done. You know, don't just arbitrarily make it and not go into the office and register the payment. There are mechanisms in place to ensure that we track what is happening. So we encourage persons to utilize those mechanisms.
While we're talking about cost and the whole idea of healthcare, is there a strategy in place to reduce the dependency on overseas care and build more local capacity?
Well, I think from the citizens contract, it speaks clearly to the establishment of polyclinics that would support the primary healthcare component, which, if we look at it comprehensively, can speak to broadening the level of services provided locally, which is building local capacity. So to answer your question, yes, but it is a work in progress. Because we do understand that the need for primary health care is just as important as the treatment abroad process and the treatment abroad healthcare program. But we want to, at some point, once we would have gotten a number of things, you know, moving in the right direction, we want to look at preventative health care as another priority for health in the country, because people show up to the hospital with stage 4 cancer. You know, if we want to take or lower costs, and of course we shouldn't put a dollar value on someone's life, but if we want to look at cost and what that would matriculate to from a medical standpoint, if you're addressing it from a preventative standpoint, you catch things earlier, you get the early diagnosis, you can get the right medical treatment. Those things also affect costs, you know, and preserves life. So that is another pillar, if I can say that, of healthcare that we want to address, and hopefully in the near future.
Now, P.S. Lewis, there again, you know, I'm speaking from the public's perspective, since this isn't a call-in, they don't have an opportunity. Guide me through the process of referral, because we often hear, oh, let me ask it this way. Can the minister send me to the United States for healthcare?
No.
Okay, guide me through the process.
So there is a process that is in place. What individuals must realize is that the only health institution that can provide a referral, overseas referral, is InterHealth Canada, the TCI hospitals.
Okay.
Even though you may go visit your private doctor, that referral from your private doctor still has to go through InterHealth Canada.
Okay.
Every Wednesday, there is a joint meeting between InterHealth Canada, NHIB, and the Ministry of Health. Our CMO, the Chief of Medical Services, and the Director of Health Services at the NHIB. They have a meeting that they call the Joint Referrals Committee. And in that committee, all referrals except urgent emergency care are tabled at meeting. And each referral from your doctor has a timeline on when the referral is to be executed, whether it's urgent or it is immediate or not. An urgent referral can take up to 2 weeks. An urgent referral, yes. And unless, and please CMO correct me if I'm wrong, but other referrals can take up to 2 to 3 to 4 weeks to be executed, depending on what the doctor has indicated. Immediate referrals, we try to execute them within 24 to 48 hours. And most times it's predicated on the air ambulance, accessibility to an air ambulance. So even if a person sends in a request to the minister for the minister to send them to the U.S., the minister has to take that request and send it to the board. The board has to make a determination as to whether or not the services can be provided within the current network, or if it has to be taken into an expanded network, which is in the U.S. There are cases that require treatment within the expanded network that don't have to go to the board or the minister. That is determined by the NHIB, depending on what the situation is. They can make that call. And then you have cases whereby, let's use the minister for an example. If the minister probably, he's been in the network, the regional network, many times, no good health outcomes as yet. The NHIB can make a determination from that. Okay, maybe he or she needs to be seen in our expanded network, and they can make a determination there. So there are cases that they can make the determination themselves for usage in our expanded network. And that's how basically the referral process works. And we have developed a policy that will speak to this, and once the actuarial assessment is completed, then the policy has been approved in cabinet in principle, and we're just awaiting the actuarial assessment so that it can be retabled.
Minister, you better hold on to this PS. She just lessened your phone calls. She just reduced them.
I mean, at the end of the day, we have to be clear as to how the process works. And I find myself, from inception, explaining the process to many persons who would call and with genuine concerns. And it's not that I take them lightly, it's just that from my chair, I want to make sure that we are able to deliver, but we have to deliver the right way. Because the absence of that can, of course, be, tragic if we don't take the right advice and allow persons to go to the right medical facilities. So it's not a situation that we are trying to separate ourselves from the process, but there are rules. There are,
and that's what I wanted PS to highlight, the whole process, because I think we weren't very sure.
There are persons open up themselves to great liability if they take certain actions into their own hands. And in those moments of vulnerability, persons tend to say and do things. So in following the process, you minimize that risk, or you manage that level of risk, and you without causing the process to falter. So I mean, it's more as we communicate more with the general public, as we use forums like this. We want to make sure that everybody has a clearer understanding of how the process works as we improve on these services.
Because I know for a fact, I mean, I've come across a number of people who think that the onus rests with the minister. That I need to call the minister and he or she can get it done for me.
I understand.
So this viewer is saying, this question, I said, it's for the minister and my guest. With a lot of the NHIB non-local, and non-local is in parentheses, registrations coming in with pre-medical conditions and gaining full coverage from NHIB after 3 payments, what are we going to do to curb this?
So it's not 3 payments. What every person subscribing in the scheme, there is a 6-month period that they must pay into, the same way that you and I had to pay into the scheme before it commenced. Every person coming into the country must pay into the scheme for 6 months before they can access care through the NHIB. Now, if the individuals are coming in with preconditions and it was not picked up through the migrant health process, that leads to another situation.
Yep.
Because that means that they could have, one, had falsified medical certificates that we didn't pick up on. And the migrant health process is there to screen all persons, all migrants coming into the country on work permit to see if there are any health conditions that we need to flag and make a determination on. So even as companies, we have to be mindful that the migrant health process is not there as a deterrent. It's there to ensure that we safeguard the health care of the TCI. It's not only worrying about persons with cancer or who will have a heavy impact on the healthcare system. It's also those persons coming into the country with conditions such as tuberculosis that could be spread within your community. So we have to be careful. We have to be careful when these situations arise. If we see an individual immediately after their 6 months probation and they have to access treatment abroad immediately, was this a pre-existing condition before you came into the country? And who is going to be bold enough to flag this for a decision to be made? That is the key right there. I mean, it's not that we are being prejudiced against anyone, but we have to protect the scheme. We have to protect the general health of the public. And as a gatekeeper, for me, that is top priority, ensuring that the health of the Turks and Caicos Islands is protected. And this is why we have programs in place to monitor and evaluate. And if there are breakdowns in the system, that's okay. Flag it. Flag it. It's, some persons may feel that, oh, how can you, how are you surviving with the criticism? It's okay. It helps you to pinpoint what needs to be fixed. And it's up to the technocrats to strategize in fixing those areas that are broken. But for me, the migrant health process can stem what the individual has flagged to you just now. And that's what it's there for.
Okay, great. Let's shift a little bit. There have been reports of IT system issues at NHIB. And are those resolved? Can you update us on those? Has it affected services?
While yes, it has affected certain components of service delivery, but we would have been in communication internally as to how we would address those concerns, and again, not using the non-compliance of remittance as a crutch. We are working, steadfast in addressing that IT issue. So I'm almost hopeful that by the time we do appear or have another level of communication, we can speak to the IT system being functional, so that we can streamline, fully functional, so that we can streamline a lot of the registration processes, streamline the collections processes, and overall help us navigate some of the financial concerns that need to be addressed as we continue with the examination. So this is a genuine concern of everyone, because we need information in order to address the problems, and the IT system was one said problem, so we are working towards fixing it.
Honorable Knowles, I'm glad you just mentioned the whole financial issues, because one of the questions I wanted to ask was it primarily the financial concerns that triggered this action, or was it just the looking at the operation holistically?
To be fair, I just think it's just overall. I mean, we don't want to just hang solely on financial issues. There are so many other components to what has transpired with NHIB. So to be fair, it's important that when we made the decision, we made a comprehensive decision to address all areas. And the report will speak to all areas being addressed. I think the reason the financial stands out is because of the dollar value in which some of the arrears or bills, would have come to. You can't not, address it. But there are a number of issues, and I think we made the right decision at the right time. Regardless of what, person's personal opinions are, we are placed here for a reason, as gatekeepers, to make sure that medical care for our citizens remains a priority and able to be delivered. So we just had to do what we had to do.
Yeah. P.S. Lewis, as part of your responsibility as head of the Ministry of Health and Human Services, following all of this, how are you going to ensure that the ministry maintains better accountability and oversight of the operation? Any ideas already come to mind for you?
Thanks for that question, Cheryl. So the ministry does play a key role in accountability. And I think once we have received the report that we're anticipating and the pathway going forward, we'll be in a better position to monitor and evaluate progress as it moves forward. And the examiners, right now we're looking at about 12 months for the examiners to be providing services to TCIG. And within that time, once they've finished their process, it is hopeful that the organization will be in a more stabilized position. And once we are at that place, and the interim board, no doubt, will fade away, and policymakers will be in a position to appoint a new board and leadership within the organization, and ensure that there is greater accountability by establishing SOPs, standards that we work by, greater efficiency and effectiveness. And that can only be done through legislations and laws and programs within the organization to ensure that it functions properly. So
just to piggyback or to add to what the PS is saying, I think from an overarching standpoint, that's the importance of the National Health Services Authority. That will help to give the ministry the support in how medical care and medical services are delivered nationally, right? So it's a number of processes, and I think one of the terms is we look at it as a healthcare reform.
I wanted to leave that for your budget
Okay.
stage.
Well, I just put that in there really quickly, right? No, because I just Well, for those listening, when they hear it, we'll double down on it and expand on it. But it's just important that people know, because everyone, we receive a lot of information from a lot of places and a lot of feedback, and I want people have to understand that this isn't business as usual. This is about stabilizing the organization, making sure that we are in a place that the level of service provided is to the standard that our people desire. So I just wanted to.
And I'm glad you said that, because I'm going to segue onto that. So, Honorable Minister, you've only been Minister of Health and Human Services for a short time. But what is the Minister's vision of quality, affordable health care for all? What does that look like to the Minister of Health?
I thought the PS was going to say that was in my budget. I think when I was on the show initially, you know, I was not in a position to experience what I would have experienced over these last few weeks. Definitely accessibility, affordability, and delivering the level of service that we need for our people. And of course, coupled with, you know, stability and continuity. And I just highlighted those words because each of them in their own right have significant components across Turks and Caicos, because we owe it to those who are not in a position to afford health care to provide access to health care. We owe it to those persons who can to provide a certain standard of health care. So when you think about it, even now with, you know, the conversation that we're having, there has to be continuity in providing health care. So in all of those spectrums, we need to, you know, take a seat and look at how we can address health care across the board, because outside of providing health care from the treatment abroad standpoint, there's the building capacity locally conversation that we have to dive into a bit deeper, because we have local practitioners who are expanding on their businesses or their medical operations who can avail themselves of a lot of these services. So we need to build local capacity. And if we build local capacity, you know, some of the monies that we're spending abroad, we spend locally. So people can now come to us for medical care, but it doesn't diminish what we are able to offer to our citizens. So that in itself, you know, and it's not far-fetched, you know, it's not lip service. I believe that it's something that can be aspired to or really attained if we are given all of the funding we need and build on those HR, you know, capacity that we are currently faced with. But, you know, when you think about small country states like Turks and Caicos, who are envied across the region, we can do a lot of those things that the Bahamas and Jamaica and Barbados and all those countries can't, you know. So as we grow and as we go through these hurdles, we have an opportunity, a unique opportunity to, yes, make mistakes, but also to get it right. And some of those countries, they can't make a mistake because making a mistake might offset, you know, so much from a financial standpoint or population standpoint. But, you know, we're definitely blessed as a country to have what we have. I think we need to also appreciate that, because we know it when we go abroad, you know, especially like the Cayman. A lot of those persons are like, wow, like this is the facility that we're going to. But again, you know, we just have to continue to build, continue to learn from those past mistakes, build local capacity, provide service to our people, and definitely uplift the standard of healthcare across the Turks and Caicos.
Now, P.S., we know that our ministers of health usually try to appease constituents, but from an apolitical viewpoint, is that vision realistic? And he's looking at you.
That's a tough one. That's a tough one, Cheryl, because I believe politicians will always be politicians. And no disrespect to my minister sitting on the side of me, but whether or not he can or cannot do it, he's going to pass it on to the PS. He's going to pass it on to the PS. He's going to pass it on to the PS, and he's going to say, PS, can this happen? How can I, what can I do in this instance? And I'm going to say, no, Minister, but if you take it from this option, look at it this way, I would always look for an alternative route that's within the law to assist. It may not be able to be done the way the person might request it, but there are options
Yeah.
that are within the parameters
Yeah.
of the law.
Yeah.
And that is the way we have to look at it. We don't always get it right. This year is going to give me 39 years in government.
Wow.
And I
Wow.
haven't always gotten it right.
Wow.
But the mistakes along the way, it has helped me to know what to do in a situation the next time we're there. And it has helped me to groom others. And that is my mandate. We may not get it right the first time. And it's not okay, and it's okay. But you have to strive to
Yes.
get it right,
Yeah.
to make things better for your people.
Yeah. So, P.S., we're out of time. Wrap up for us. What's your message to Turks and Caicos in terms of health care?
So in terms of healthcare, without giving too much of what the minister is going to say in his budget speech, in terms of healthcare, for right now, I would encourage people to remain hopeful. Globally, it's challenging. Healthcare is costly worldwide. The Ministry of Health, like every other ministry, we are fighting for a piece of the government's pie financially. And we work within those parameters. But I would say to the general public, make sure you get your annual medical checkups. Ensure that if you are on treatment, you comply. I would also say, ensure that you continue to pay your NHIB contributions and you continue to take the advice of your medical practitioners, and you live a healthy lifestyle. It's not easy giving up the pork chops, the
Oxtail.
the pigtail, but it will be worth it at the end of the day.
Right. And Minister, the last word is yours. Your
No,
message?
No, I definitely agree with what the PS would have said. You know, it's important that we take our health into our own hands and do so responsibly. And I would also just use this opportunity to say to the wider public, especially the employers, you know, to continue to pay into the scheme. As I stated, you know, we're definitely going to be looking at compliance as we work through these rules, and definitely expect more communications from us, you know, through various mediums, probably not back on the show so soon.
At least not with me.
But it's just important that we control the various narratives that are out there.
Yes.
Because we are working.
Yeah.
You know, we are putting the resources into the right areas to address them, so that the level of health care remains accessible across the island. So we're here, we are listening, we are empathetic to all of the issues and concerns that are being faced by the wider public, but we also ask for your partnership in executing on a number of these initiatives, because it has to be a collaborative effort, just because of the nature and the sensitivity of healthcare in these islands. So thank you very much.
Yeah. So we'd like to say thanks to the Honorable Minister of Health and Human Services, Honorable Kyle Knowles, and to the Permanent Secretary in that ministry, Mrs. Desiree Lewis. We also want to say congratulations and thank you to the PS for decades of service,
Yes.
to the public service and to the Turks and Caicos Islands. So PS, thank you very much for your service and for what you do daily. And Honorable Minister, continue to do well,
Yes, thank
continue
you.
to keep us healthy. This has been First Edition.